Good day, everyone, and welcome to the webinar, Price-Based Policy Changes for Obesity Prevention, New Insights on How Food Prices Influence Black Americans. This webinar is presented by the African American Collaborative Obesity Research Network, AACORN, a national organization based at the University of Pennsylvania. The program will last for 1 hour, ending at 3 p.m. Eastern Time. My name is LaShawna, and I will be managing the web communications. Today's program is being recorded. All audience lines will be in a listen-only mode during the program. However, you are encouraged to submit your web questions throughout the webinar as you think of them by clicking on the Q&A link at the top of your screen. A box will appear on the screen in front of you. Simply type your question in the box and then click on the Ask button. Our speakers will address as many questions as time permits during the question and answer period. Our presenters today are Dr. Shariki Kumanyika and Dr. Catherine DeSantis. Dr. Shariki Kumanyika is a professor of epidemiology at the Department of Biostatistics and Epidemiology and the Department of Pediatrics at the University of Pennsylvania Perelman School of Medicine in Philadelphia. She is the founder and chair of AACORN. Also joining today's program is Dr. Catherine DeSantis, assistant professor in community and global public health at Arcadia University, also in Philadelphia. Her program of research is broadly aimed at understanding socio-environmental influences on family feeding behaviors and beliefs which relate to childhood obesity risk. And at this time, I would like to turn the program over to our moderator, Vicki Lassiter. Please go ahead, ma'am.
Hello, everyone. This is Vicki Lassiter, and I will be serving as the moderator for today's webinar. Before I start, let me say a few words about the network. The African American Collaborative Obesity Research Network is a national research network comprising of a diverse group of 70 core members who are academic researchers, scholars in training, and community-based research partners. We are working together to improve the quality, quantity, and effective translation of research on weight-related issues in Black American communities. I encourage all of you to link to the network's online community through our website, acorn.org, for additional information and resources. We hope that your participation in today's webinar will enable you to identify how food costs influence food purchases of diverse Black Americans in light of other relevant influences, as well as consider implications for our potential to foster childhood obesity prevention in Black communities through policies related to food prices. At this time, I'm going to turn the program over to Dr. Kumanyika to begin today's presentation.
Thanks, Vicki, and welcome to those of you who've joined us for this webinar. I'm going to start off with some background on food marketing, why it's a public health issue, why we're focusing on food prices, what the key controversy or big policy issue is, and why this is a particular issue for Black Americans. So first, food marketing. I think the broader issue here is the food marketing environment that consists of not just food price, but products, where products are available, how products are promoted, especially to children, and that includes all forms of advertising and promotion, ads and websites and even word of mouth and giving out free samples and promotion of a brand, if not the product itself. We think of price as the monetary cost of food at the point of purchase. I specify the point of purchase because, as we all know, there are a lot of upstream factors that affect food prices, prices of commodities. But the food supply is such now that we're the landscape is really dominated by packaged and pre-prepared foods, ready-to-eat foods. There are thousands of products, and they're highly differentiated, and so the monetary cost will be only a part of what we see as price. We have to think of the way marketers look at price, which then includes more broadly anything the person has to give up, anything that a person sees as a value and they're willing to pay something in exchange for it. So it's not just the monetary cost. Both in social marketing and commercial marketing, it's what is exchanged, benefit, and the cost to that person. So why is this a public health issue? I think the big question is whether food marketing contributes to the high rates of diet-related diseases like diabetes, heart disease, and cancer. Specifically in terms of obesity, whether it's contributing to the obesity epidemic and the increases that we've seen at the same time that the food supply has changed. And so there's a direct link that people are making between the proliferation of high-calorie packaged foods and the increases in obesity rates. For socially disadvantaged populations, the question is whether there's a systematic effect of food marketing in predisposing to higher risks of diet-related chronic diseases and obesity. So we look at low-income populations and racial ethnic minority populations, and in particular we're interested in African Americans. So why are we focusing on the price issues? Specifically, we also do work on food marketing more generally, but we've really come to recognize that there's a contribution to be made in the area of food prices. First of all, price is known to be a very strong influence on food purchases, and this is documented. Price is an influence on the purchases of everything, and it applies to food. Food is a basic need, and there's some differences in how much people respond to changes in the price of food, but it's a strong influence on food purchases. The story usually goes like shown on the second bullet here. You know, the lower the price, the more people buy, or they buy it in larger quantities. So if we're looking for ways to change behavior, we want to look at price because we know it has an effect. And when we talk about the point of purchase prices, we're really getting to the aspect of price that marketers, food manufacturers, and retailers have some latitude in. So commodity prices, if it's raw commodities, that's something that's beyond the interface with the consumer. But the products you see in the supermarket or in restaurants, there is a chance to manipulate those prices in ways that might have an effect on behavior. The profit margins are also an issue because since so many of the aspects of food prices have already been determined, the base cost of food, the profit margins on food are really not that great. And so when the less healthful food is the kind of food that leads to a higher margin of profit, healthful foods may cost more, and this is really what causes us to focus on the issue of price. Food price and health specifically could work in two ways. It could work for us or it could work against us. So given that price is a big influence, lower prices on the less healthy foods lead to higher calorie consumption, and there's good evidence on this. The mechanisms for that happening, one is that people might buy more, and it's kind of a see more, eat more phenomenon. The product is there, you see more of it, you use it up faster. There's also a kind of behavioral effect of an implied permission to eat more. Say if it's one of your favorite foods that you really don't think you should have too much of, you might eat more of it because you got it at a low price, and there's an implied permission to do that. Now, lower prices can also increase the purchases of healthy foods, but when that happens, the studies that have been done cannot determine that will always lead to a healthier diet. So you might buy more healthy food, but you may not decrease the purchase of unhealthy food. Your dietary quality may not improve, and your calorie consumption may not decrease. So here we have the situation where food price is important. It may be driving people's behavior in the wrong direction in terms of health. We may be able to improve people's eating habits in terms of health if we could do something with the prices that the consumer sees. But the policy question is whether this is an important enough issue to warrant the government interfering in the free market, in the dynamics of the food marketing environment. So that's what's underneath this all, and it becomes very, very controversial. If people decide, okay, this is a big problem, we have high obesity rates, we should have some government intervention of this type, what are the best strategies? And I put here a list of some of the things that are being debated right now as we speak. Should you tax high-fat foods or sugary beverages? Should you restrict large portions? I think you could probably all know that's New York City where that's been talked about. Should you restrict the purchases of certain high-calorie products with SNAP benefits? So my final point in giving the background and rationale for the study that we'll present as the main part of this webinar is the strong evidence that there are inequities in food marketing environments by race, specifically for African Americans, with the availability of foods, what kinds of foods, what kinds of stores are available in neighborhoods, and the promotion, what kinds of foods are promoted to African American audiences, and systematically these factors are less favorable in black communities and in black media channels across the country. In addition, relatively more black people live below the poverty line. So some of these same inequities relate to low-income populations. And then because of that, we are interested in both the income-related issues in food marketing environments and those that seem to be ethnically targeted to black Americans. On the price issues, the literature has been mixed. We don't really have a comprehensive picture of how price works. We're uncertain as to whether price is involved or how it's involved. Are prices in black neighborhoods systematically higher? Are they systematically lower? Or are they more variable, making it more of a challenge to find a good price? And I think a big issue, what are the prices like relative to what people feel they can afford? And these issues have not really been studied in a comprehensive picture, and so the study that we'll present here was one that AACORN designed to take a closer look and a more comprehensive look at some of these issues. So I'll turn this over now to Katie DeSantis to present our study.
Thanks, Shriki, and good afternoon, everyone. So I will be presenting results from our recently published paper in the March issue of the American Journal of Public Health. And the paper was titled, What Price Means When Buying Food, Insights from a Multi-Site Qualitative Study with Black Americans. So first and foremost, we'd like to acknowledge our co-authors, two of which are on the call today and will join us in conversation, Monica Baskin and Deborah Ram-Young. And I would also like to acknowledge our funder for this research, and that's the Robert Wood Johnson Foundation, who supported this research through a grant to AACORN. So these analyses were performed on data collected from 4 cities across the U.S. in Baltimore, Maryland, Birmingham, Alabama, Chicago, Illinois, and Durham, North Carolina. And our investigators at these sites were funded by AACORN and engaged with community partners to tailor research protocols to their respective communities. So we'd also like to acknowledge the community collaborators as well as other colleagues that have assisted with this research. And so the field sites investigators were engaged with AACORN to collect the data, and then the AACORN home team performed the analysis for all the sites, and that's what we'll be presenting today, the multi-site analysis. And first, I just wanted to let you know what type of data was collected and what the objectives were by site. So because community partners were engaged and there was that tailoring, the objectives varied slightly by site, which is presented in this table. It also presents the method of qualitative data collection. So you can see we engaged youth and adults, and at some sites both youth and adult African Americans. And The sites used a variety of methods to collect the data, including focus groups, interviews, and photo elicitation focus groups. And just in case you're unfamiliar with photo elicitation groups, they require and ask participants to take photos, and in our case we gave them disposable cameras, and those cameras are returned to study staff in advance of the focus group, so the photos can be developed, and then participants are able to use them during the focus group, in part to help them elaborate on their thoughts and feelings, and the focus of these focus groups were to elaborate on perspectives of their food marketing environment and also other influences related to food purchases. So in Baltimore, the objective was to speak with youth and adults and to really focus on youth food shopping. Birmingham and Chicago coordinated to use similar protocols, and the objective was the same, which was caregivers were interviewed to learn how food environments influence what their families eat and also where they buy food and what types of food they buy. And in Durham, caregivers and adults participated in both focus groups and interviews, and the goal in Durham was to identify perspectives on environmental and cultural influences on children's food preferences and also caregivers' food purchasing behaviors. So in terms of design, this was, as I mentioned, a multi-site study where we took the data from across the sites and tried to focus on food prices within the context of the mix of foods available, so looking at availability in terms of actual food stores and also products that were available to the participants, talking about food price related to general food shopping patterns and resources, and also food prices related to priorities and perceptions when making food purchases. So in order to accomplish this data analysis, we performed a conventional qualitative content analysis. And this method, the goal of this method is to reduce a large amount of text in order to identify core and consistent themes that describe meaning from the participant's perspective. So it's really focused on the participant voice, where themes emerge from the data, rather than approaching data in a directed manner, where perhaps the researcher's past experience and knowledge on the topic might intervene with some of their observations. So the method really helps to keep the researcher from imposing their thoughts, judgments, and beliefs on the data and lets the participants speak in their own voice and lets the theme emerge from the data. So in order to facilitate this, we used in vivo software to help us with the coding process and the development of categories and themes. So in Philadelphia, we had a team of 4, a lead researcher and 3 coders, and each person was assigned to a site. And they worked on that site's data, and we would come together in weekly meetings to discuss emerging code. So anything new that had come up, or if a code had further developed in terms of its definition, we would share that at these group meetings. And that's where we were able to understand where there was convergence between sites, where a code was found at one site and a very similar or the same code was being used at another site. So that was the process from the very beginning in order to allow the sites to stand on their own, but also understand what was going on between sites. And once we had developed a preliminary code book, we were able to perform an interconsistency analysis to make sure that the code book was being used in a consistent and uniform manner between the sites, and because we had 4 different coders working on this. So the coded text was put into categories, so where codes related. Categories came about and eventually emergent cross-site themes were developed. So we were able to use in vivo software to help us take the numerous codes, or over 100 codes, and begin to group them into categories and subcategories, which eventually led us to our emergent themes that we'll share with you today. And we did not remain isolated here in Philadelphia, because we certainly recognize the importance of being engaged with the field sites who had actually collected the data, who are in the communities where the data came from, and could help make sure that our analysis was on the right track. So coded text segments were reread and discussed to understand themes and understand which themes were really common across 4 sites, because that was really what we were focusing on in this particular analysis. And it also allowed for a more clear description of the themes, adding depth and dimension, so we really understood every aspect of the theme and all the complexities that were involved. So now we'd like to share with you the findings. So we have 6 themes that I'll be presenting, and first I'll give you some background information on where the data came from, and then we'll talk about the theme. So I'm going to do my best to describe the theme, and then allow you to take a look at prime example participant quotes so that you can really hear the participant's voice and understand how that theme came about based on the qualitative data that we had. So in terms of who we were able to engage in focus groups and interviews, we had 42 youth and 75 adults participating. And the sample was primarily female, and that's for both youth and adults. And we had a diverse sample in terms of income and education. The only information we collected on income, for the most part across the sites, was related to use of public assistance. So 60% of our sample reported no public assistance, and of course that's the adults reporting, and then 50% of the adults were college educated. The youth in the study were 12 to 17 years old, and adults were 17 to 63 years old. So now I'll present to you the cross-site themes. And in order for a theme to really develop and be a part of this particular analysis, it had to resonate with at least 2 sites. And we'll also talk about in the description where certain sites stood out in terms of different perspectives on that particular topic or on that theme. So the first theme is called Getting Low Prices. And this theme related to participants talking about how they looked for prices which they described as affordable, quote-unquote low, and quote-unquote good. So these prices, when participants really elaborated on it, were often talked about related to quantity and quality of the food, and also the price. So all those things were working together. So they were looking to obtain adequate amounts of food at the quality level and also at the desired price that they wanted. And in some sites it was mentioned in the context of budget. So we saw that in Chicago and in Baltimore, whether they were talking about family budgets or the budgets of youth, that getting low prices was a big part of shopping when people were working with certain budgets. So now I'll show you some example quotes from our sites. So this is in the participant's voice, and I'll just let you take a moment to read these 2 quotes from Baltimore, one from an adult one for youth. And I just wanted to provide a little context for the first quote. The participant was speaking to a photo of a fast food meal during a photo elicitation group, and this is what they had to say as far as, you know, how a family might perceive the meal. Okay. And now moving on to our next theme. This was called Cost of Limited Choices. So this is when participants were speaking to their food environment and what they had access to in their immediate food environments. And we noticed that this was mainly talked about by parents in Chicago and youth in Baltimore. So they asserted that their food environment exposed them to low-quality, unhealthy food at high, unfair prices. So in Chicago, this was talked about in relation to corner stores often. So those were the stores that were close to their home and their immediate food environment, but didn't offer high-quality food. And not only that, the food was unhealthy and it was also very highly priced. And in Baltimore, youth were talking about it quite a bit about schools, and they felt like their schools were exposing them to low-quality, unhealthy foods, and that the food was also not fairly priced. So in Chicago, they also mentioned a strategy to try to deal with the limited choices they experienced in their neighborhood, and they talked about using multiple stores to avoid high prices, and that this often involved traveling outside of their neighborhood. So here we have quotes to elaborate on this theme and illustrate the participants' perspective. Okay. Our next theme is called Low Price Foods Save You Time. So this is when participants were speaking to the fact that some of the low price foods that they were familiar with also offered a convenience factor. So that if a low price food was also convenient, it really increased the attractiveness of that product. And this was spoken to in the context of many ready-to-eat foods. So one example would be getting a quick meal from a fast food restaurant that was relatively low cost and also offered families time and labor savings compared to a meal that they would cook at home. So it really offered a few benefits beyond just the low cost. And this was mainly spoken about in the context of busy family life, where caregivers and even other adults describe the need for quick meals and quick snacks due to the pace of life that many of the participants felt that they were living. So we have a few quotes here for you to read and illustrate this theme from the participants' voice. Okay. Our next theme has to do with healthy food. So the theme is called The Price of Healthy Food. And this is when participants talked about how they felt it was difficult to find foods that offered that low price, also offered the quantity that they desired or needed for their family, but also offered health benefits. So participants really didn't express that they didn't care about health. It really wasn't a matter of caring or not caring, but really trying to balance the need for a certain quantity, a certain price, and also seeking the health benefits they desired. So some describe buying low-cost unhealthy foods simply because price took precedence at that moment. So we actually have a quote that nicely provides an example for that when talking about purchasing white versus whole wheat bread. So I'll give you a moment to read these quotes. And then we have one more quote related to the price of unhealthy food. And I mentioned that participants were looking, as far as when balancing whether to buy a healthy item, they were looking for quantity, but quantity wasn't just, a volume issue. It was also thinking about fullness and whether a product had the potential to offer fullness to either themselves or their family, whoever was going to eat it. And that was illustrated by this quote here. So you can see that adult is really emphasizing the importance of fullness as another thing to think about when trying to understand how both price and the healthfulness of a product interact. Then we have a theme related to advertised brands. So this theme was called the pricing and appeal of advertised brands, where participants really perceived advertised brands to be high-priced, but also really enticing. And this was a lot of times adults talking about their own children or just children in general and adolescents. And they would also acknowledge that they are enticed, but a lot of focus on younger individuals. And the appeal was related to the advertisements themselves and the visual effects they have, the celebrities that they use to endorse the products that appear in commercials and print ads, and also the music that's used in different advertisements that can really draw in consumers. So participants who were parents also described trying to teach their children that advertised brands are not necessarily offering a better product. So an example being that the product might be manufactured by the same company, but a different label is on it, and you're paying a different price. So we have some quotes to elaborate this, and one really speaks to a parent trying to explain to their child about advertised brands. Okay. And our last quote, our last theme has to do with parenting and parents' perspectives on the importance of child and family preferences. So preference for low-priced foods was intertwined with other considerations for families. And this is mainly when they were speaking to getting the food their children prefer, and also food that they perceive as healthy for their child or for their family. So really balancing preference and also perceived healthfulness. And this was talked about in the context of low prices in some cases because parents worried about meeting some of their children's preferences because they were worried about food waste. So even talking about it, buying a new, healthier product that, some worry over whether the food might get wasted if the child didn't like that food, and the security that they know in buying products that their children already prefer. And there were also contrasting views that were really displayed as far as parenting approaches to buying foods. So there was indulgent approaches that were described. There were authoritative approaches which tried to balance children's needs and their preferences, while also enforcing some of the parents' ideals as far as what they want their child to eat. And also avoidance styles mainly talked about trying to avoid pestering from children. So we have our final quotes here from our participants to illustrate this theme. So now I'll just summarize our findings for you before Shriki rounds out our presentation with some takeaway points and implications. So for this particular study, we felt that it really provided evidence that price was salient in this diverse sample of African Americans. So it really illustrated to us that it's not just a low-income issue, that price is important for a variety of people in this diverse sample. And our work really resonates with published data that is available to say that African Americans experience more difficulty in achieving health protective eating patterns, in part because of a relatively higher cost and just other challenges that they face, which were described here. And also that price-related policies and interventions which favor healthful foods, so which are looking to favor foods that are higher in nutrition and lower in calories, that these are going to be really important and essential part to addressing obesity-related health disparities in African Americans. And there was a clear importance of low price, but it was really weighed against other value considerations, which showed us the multidimensional nature of food purchasing decisions. So there were numerous value considerations mentioned, including family preferences, convenience, and also healthfulness. And healthfulness was important, but at times low price did take precedent, and it really wasn't a matter of people caring about or not caring about health. It was a little bit more complex than that. So people really described trying to balance these things all at the same time when purchasing food. And last, there seemed to be some frustration with the unhealthful nature of many low-cost convenient foods. So certainly participants expressed the need, in part due to our lives, for convenient foods, and also low-cost foods, and that it was unfortunate that they tend to be unhealthy. So that really summarizes the findings from this multi-site study. And now we'll try to sum it up, and Shriki will make some key takeaway messages from this particular study and our research in general.
Thanks, Katie. A great job of summarizing our findings, and I think making the key takeaway point that is the contribution of this study. Even though we've known that price is important, and I've given it here pictorially, so if you don't want to listen to the words, just remember the picture. It's important, but it's much more complex than we've allowed it to be by just thinking, for a 10% increase in price, people will buy more. That's true, but it doesn't tell you about the nuances at the consumer level. We think that conceptually, efforts to think about price in a policy context really need to include this broader range of perceived value considerations and design the policies so that we can maximize the potential effectiveness of any policies in high-risk communities like African Americans. So I've set up the discussion or the way we could think about this in terms of implications. How are the considerations that we identified from the people who participated in our study, how will this, knowing that these considerations are there, affect potential strategies for manipulating prices to achieve health? One thing that's kind of the unspeakable, will people pay more? Can we get people to pay a premium for healthier products? Can we use the information about what other types of value people might perceive to figure out ways to encourage people, to the extent that their resources permit, to pay a premium for healthier products while also thinking about how to maybe achieve parity between the healthy or maybe even advantage with the healthier product. So at the bottom of the slide is just a menu of possible interventions that are being tried or have been talked about, and we have to think where we want to put our resources in the price realm. You might have some other ideas that we don't have here, but I think I'll now turn it back over to Vicki. She's been looking at the questions that I hope you've put up on the website, and we'll try to answer some of your questions.
Okay. As Shariki described, we encourage you to look at the top of your screen. There is a Q&A button that you can click at any point, and just drop in your question and hit the Ask button, and we will try our best to address the questions that are coming in. At this time, I'm going to ask if the line can be open for our two co-authors of the price paper that are on the line, Drs. Monica Baskin and Deborah Rome-Young. The first question that I will direct is related to the community partner nature of the studies that you had at your individual sites. So I will direct this to Monica and Debbie. The question relates to if there were any reactions from any of your community partners at the conclusion of the study or any activities that followed your individual studies as well.
So this is Monica Baskin at the Birmingham site, and I'll start by just saying that our community partner was Congregations for Public Health, which is a nonprofit organization of a number of churches in the Birmingham area that focused on doing outreach and developing interventions to support health equity. And in terms of the feedback we got, all of our results were presented back in community forums where we got a lot of ideas from community members about moving into action, do some things about what they found and the perceptions there. So we are actively involved in ongoing discussions about moving into action in a number of these areas, and there are other nonprofit organizations in the city that are focused on looking at food policies, either through our Food Policy Council locally or through other nonprofit organizations.
Hi, this is Debbie Young, and I represent the Baltimore site. Our partner was the Baltimore City Schools, specifically one public high school that serves just girls. And we presented our results to our community advisory board that consisted of girls, teachers, parents. I think that was it. The information was mostly taken back to the school and used to perhaps consider more carefully the foods that are used in the not in the school lunch program, but the competing foods area, and there was a lot of concern about the quality of those competing foods and their prices and the availability of that. In addition, there is a current push going on in the Baltimore City Schools with working with local farmers markets and local farmers to increase the amount of local foods that is being distributed in the school lunch program. So those are good signs of things that are going on in Baltimore currently.
Okay, thank you. I'm going to pose this to the panel here. Could you expand on the idea of subsidies or price incentives for purchasing healthy foods among SNAP recipients, particularly thinking about promoting healthy food purchasing and the domestic food program, if you can give some commentary on that?
Well, this is Shariki. I'll start off. I don't know if anyone else will want to comment. I think that, first of all, I have to say that I think of SNAP as a social program with very broad goals, and to enable people to buy a healthful food and make their choices, make these considerations of the type that we've talked about. Some of our data and the broader evidence on this topic suggests that when people do have enough resources, they are free to make choices that can include choices for healthier foods. But when their resources are restricted, like when the benefits run out toward the end of the month, for example, then price becomes the bottom line, and all the other considerations may fly out the window if there just are too limited resources. So I think some of these findings really support the idea that we should understand as much as we can about how people are making choices, and that the policies that would guide people towards the healthier choices could be particularly effective among people with SNAP benefits, because that's when they have the latitude to really make the choices.
Okay, thank you. Our next question, again, is looking at the idea of price. And if you could address some of the possible policy implications of the price element being expanded to include more than just the monetary cost, especially time.
Yeah. So this is Debbie. One of the themes that came out is the convenience, and we didn't really talk that much about the time piece of convenience, but I think that's where it's really going here. And individuals do think about the time that it takes to cook a healthful meal, and there are, I believe, policy ways in which that can change, in which food companies are encouraged to develop products that are convenient, but that there's also more put together pieces of it that can be more helpful. For example, you're seeing those, I think, in some of the smaller stores, and a little bit more of the elite stores, where things are packaged in a way that you still make it at home, but it is more healthful. And one of the policy considerations is to scale those types of foods up so that they're available more broadly. So that's, so people can get healthful food that is still convenient, but they're not starting from scratch to make something at home.
Yeah, I agree with that, Debbie. This is Katie. Definitely, it's a skill and a time issue, and I think there's certainly programming out there, and starting to be more about cooking, which is great. There were plenty of quotes from our participants that said, people just don't know how to cook anymore, which I think we're hearing a lot in general in research. But there were also other parents that said, whether I can cook or not, I don't have time to. So I think Debbie brings up an important point of, policy not just moving into the direction of teaching, going back to teach people how to make these complex meals, but just doing simple things like figuring out how to get these things that can move a meal along quicker, like the pre-sliced vegetables, pre-washed vegetables and fruits, and other products that are partially cooked or prepped would be really helpful for families.
Our youth told us in these focus groups that they will get a more healthful meal if it's made at home. So the knowledge is there that when they eat at home, it's going to be better than if they grab it from, or if it comes from a store, a convenience store, or fast food restaurant type of a place.
Okay.
This is Shariki. Oh, I was going to add one more comment on this. Do I have time?
Oh, go ahead. We're going to take one last question after this.
Okay, great. So sometimes the issue of education comes up, and a lot of the traditional approaches have been focusing on consumers and teaching them how to navigate this environment, which I think has become so complex and so aggressively in the opposite direction to health that's going to be a losing game unless we can do something about the environment. But there is one place where education and policy come together, and that's with SNAP-Ed. The funds that are devoted by policy to nutrition education for a population that is participating in SNAP or eligible for SNAP benefits, working together with the expanded food and nutrition education program. And I think that there's some implications here for how one approaches education with people who are participating in nutrition assistance programs, not assuming that the issue is only a behavioral one about people's preferences, but really taking a very sophisticated look at the food supply and how people interact with it, and maybe helping to drive demand in certain ways that the retailers who benefit from these benefits as well, because they're spent in their stores, would get the message and be able to meet the consumers halfway.
Okay, thank you, Shariki. We're going to take this one last question, so if we can get one of our presenters to respond, that would be wonderful. From an intervention perspective, how can we modify values or meanings of food to be more aligned with public health goals?
Big pause.
That's a really good question. I'm not sure. I guess since I'm closest to the data, I guess in terms of that's a more general question, so maybe Shariki can speak to it more generally. But there was talk at our sites about the values and meanings of food, and with some acknowledgement that some of the some values, for example, the wanting to have your child feel full because you experienced hunger in your life, those type of values, that they weren't, there's some acknowledgement by the participants that wasn't necessarily the healthiest perspective, but it was something that they felt and was certainly something that would be harder to change. So I don't know that, I'm not sure how much we have to modify the values and meanings of food, because I think people are on the way. That's at least from this data what I feel. But maybe adding more motivation would be, a role of an intervention perspective, and creating new values potentially.
This is Monica. So one of the other ways in which, in other work that I've done in terms of interventions, we've really utilized motivational interviewing a lot of times to point out what people's larger values and value systems are and link them with the particular behavior, and pointing out potentially the discrepancies between what they're valuing and what their behaviors are. And so that has been very helpful in some of the other work that I've done in terms of interventions related to healthy eating and physical activity.
Yeah, Monica, that's a great point. And, I think sometimes we're bringing this, when we're having these focus groups and in-depth interviews, we're bringing this information to the consciousness of the participants, and maybe they're not necessarily thinking about it until we start to raise this consciousness, and I think that's another intervention strategy that can be pursued, is just raising people's consciousness of these disparities, and rather than accepting that's the way it is, that cheap food is cheap and that this is just what we get because it's convenient.
Okay, well, I thank you to all of our presenters, as well as, for everyone for joining us today. I will share that links for today's webinar, the audio recording, as well as the slides, and a bibliography of AACORN members' food marketing research publications will be sent to you by Maria Rupert from AACORN within a week. So again, I thank you all for participating in the webinar and have a wonderful day.
And that does conclude the webinar, Price-Based Policy Changes for Obesity Prevention, New Insights on How Food Prices Influence Black Americans, hosted by AACORN. Thank you so much for attending. You may now disconnect.